I think this is a good time to bring in Alef. And Alef, perhaps as a humanitarian, maybe you can tell us why it's important to have a fund such as the Solidarity Fund, particularly in a country like South Africa.
Palesa, thank you so much. And again, also thank you, Sharon, for hosting this webinar. From a humanitarian point of view, particularly from a South African context, being still one of the most unequal countries in the world, I think when COVID hit, there were a lot of people who wanted to contribute, people and companies alike. And the Solidarity Fund provided a platform or an organization where they could make a contribution like that, where there's a lot of social capital in the fund, where they can reach out to organizations such as Afrika Tikkun from a food relief point of view, that can help with the immediate need in the communities underground to provide relief where necessary, because a lot of people are living hand to mouth. And when there's no money coming into hands, it immediately impacts from a hunger and from a nutritional point of view. And by being so agile and by moving so quickly with the Solidarity Fund, we, as one of the implementing partners, we've been able to, within weeks of the pandemic, distributing the necessary food. So I think that's why it was really important for such a platform to be set up.
Fantastic. And in terms of your work that you've been doing hand in hand with the Solidarity Fund, what are some of the stories or success stories, or even your experience on the ground, that you've come across?
Yeah, well, I think one of the things, and I must commend my team on it as well, is we had to pivot our organization quite significantly. We are an organization that focuses on sustainable developments, and we call it from cradle to career. And within weeks, we said, look, we have to focus on this, on the pandemic and on the results, that the consequences of the pandemic in our communities, and really shift from a holistic developmental approach towards an emergency relief program. Some of the stories, and one of the biggest stories for us, is that we were able to distribute 24,000 food parcels in a time space of 2 to 3 weeks. That's within our communities in Gauteng and the Western Cape. One of the coolest stories that I've seen come around is that there was a go-go coming for a food parcel. And those food parcels are not light. And initially we were distributing through our centers. And she came to collect a food parcel at one of our centers, and she couldn't carry it. And with the risk, there's always police available at the sites. And 2 police officers helped carry her food parcel back to her place, where she didn't have anything beforehand. Now she had food to feed herself and her family for a month, sorry. But it did show some of the collaborative responses in the community, and particularly also, in that case, a shout out to the men and women in blue who helped someone in need. But there are tons of those type of stories of people who really didn't know what to do, didn't have food or any means to buy food, and were helped through a food parcel in this time. So I think that was just one of the examples that stood out for me.
Sure, that's fantastic. And what a wonderful story. I think actually we've seen a lot of those stories across the country, with communities coming together to help each other and to help different people. And I think even the Solidarity Fund itself, I know as individuals, people can contribute to the fund as well as organizations. So it's really sort of that mechanism that has brought the country together to create change together. So you mentioned gender-based violence earlier on, and I think maybe, Alef, if you could tackle this one. I just wanted to find out, it is Women's Month in South Africa. Last night, in fact, I heard of a term called she session, which was the first time I was hearing it, and what it implies is how women globally are affected by the recession or recessions. And, front and center of what we're talking about right now is the women of South Africa who are affected by, COVID-19, and who are part of that community that is adversely affected by COVID-19. But on top of it all, you've got a crisis, a gender-based violence crisis in the country. How has your organization, Afrika Tikkun, been impacted by this, or how do you deal with this? And also in your partnership with Solidarity Fund?
But I think there are two elements to this. The first element is what we as an organization, it's kind of our core, is we aim to get young people into sustainable jobs, or into entrepreneurship opportunities, self-employment. And the fact is still that the people group that needs that the most, because they suffer the most from unemployment, is Black women particularly. So for us, that's a significant group that we try to help by our Cradle to Career model, by ensuring that they have access to job opportunities, to learnerships, to and we're currently starting an agripreneurship program. But again, the emphasis should lie on how can we get women into those kind of sectors, right? So the idea of that is to really empower women, and we have it's called an empowerment program, to ensure that women become less vulnerable from a gender-based violence point of view. Secondly, there's also a big element of awareness in this for both men and women. And what we have is a YouTube channel for both young men and young women, where they address things around gender and also things around gender-based violence. What does it mean? Like when you say no as a guy, what does it mean? How do you respond to that? And as a woman, how are you empowered to say no? And particularly around things like gender-based violence. And also, what are routes you can go when you have experienced something like this? And there are fantastic organizations in all the communities that we work in that deal with those elements, from awareness all the way up to how do I get to a police station? How do I ensure that I'm safe as a woman? And how do I ensure that my family in that sense is safe as well? I have a particular vested interest in it because I have a young colored daughter who I want her to grow up in a world where she can be secure in her gender and race, without feeling, one, that she is set behind from a salary point of view just because of who she is, but secondly also that she can have secure relationship with people of the opposite sex.
Okay, Alef, was there anything you want to add to that?
Okay, absolutely. And I think when we started with the relief program for the Solidarity Fund, what we were extremely encouraged about is that within the time frame of a week, we had about 200 volunteers helping, from Boy Scouts to corporates to our own employees and our own beneficiaries for that matter. And that was really, really encouraging to see. And another thing I want to mention on it is, because this is related to the UK, we have an annual event from a UK point of view, where this year there's a sporting event taking place. It's called Spirit of Belron, which is one of our corporate donors. But they are doing a 40,000 kilometer across the world type of event where people are running and cycling and swimming and all the like. Wow. And again, the apathy that you see by people just being involved to sacrifice their own time, to sacrifice energy, and to sacrifice finances for the greater good of the South African people, and in this case, obviously to sponsor Afrika Tikkuns work in our communities. Mm-hmm. So we see a lot of it happening, not just in South Africa, but also in the UK and around the world.
Thank you very much. One last question I'd like to ask Adi, but probably more Alef, I think this might be more from your point of view, is we all talk about people getting sick. We talk about people physically having the COVID virus itself or worrying about getting it. But there's the whole, not so much the humanitarian side, it's the mental health side. How are people going to, or how can you guys on the ground, through the Solidarity Fund or just through Afrika Tikkun, how can you help the mental health aspect of people who are holed up in a flat or in a township or wherever it might be, or worried they're going to lose their job or have lost their job?
Sharon, that's an excellent question. I'm going to use our own example, our own organization as an example, if I may. So in our own organization, we have had 2 people pass away in the last 3 months. We've had people on intensive care, and quite a few people who have contracted the virus, including myself. I was asymptomatic. But what it does in an organization, it on the one hand creates an incredible sense of unity, but on the other hand, it also creates uncertainty about one's own mental health, and particularly also, if you're young, about your family members who are in the risk categories, isn't it? So what we've provided is immediate access to counselors, so to therapists, to social workers, through the like, and have necessarily been able to give mental support and emotional support to both our staff members and the community alike. Where then the question came is, who is going to assist the counselors, right? Because those who are doing such important work with our staff members and beneficiaries. And so we have psychologists who are offering their services either pro bono or at a very reduced rates, who have also offered to help our counselors and our social workers with the emotional and mental support. And secondarily, I think when it comes to people who've lost their job, it's keeping our programs alive, ensuring that we give them emergency relief on the one hand, but also don't lose sight of the fact that we need to do something about the other crisis, which is around unemployment, in order to create more long-term sustainability of our communities.
Thank you.